Health experts believe the pandemic is compounding the problem of childhood obesity across the United States. They say school closures and a virtual learning environment is causing kids to gain weight. According to the CDC, 1 in 5 children and adolescents are currently battling obesity. For more on this, I want to bring in Nancy Roman. She's the president and CEO of Partnership for a Healthier America, which was launched in conjunction with former First Lady Michelle Obama's Let's Move initiative. Hi there, Nancy. Before we get into the specifics of how the pandemic is affecting childhood obesity rates, I'd like you to start off by just explaining for our viewers why this is so important. What are the risks associated with childhood obesity?
Yeah, thank you. Well, it's absolutely critical, and nobody really minds a cute, chubby kid in terms of appearance. But what we learn is that if you are obese as a child, meaning that you're carrying extra weight, you are more likely to be obese as an adult. And if you're obese as an adult, you're more likely to have diabetes, heart disease, and other diet-related diseases that predispose you to an early death. So it's really critical to pay attention to obesity rates.
So the Obesity Research Journal in July said that childhood obesity could increase by more than 4% after just 5 months of school closures. For many children, they've been out of school buildings for nearly a year now and potentially even longer. So how big an impact might this have?
Well, I think the impact can be pretty big, right? For multiple reasons. One, kids at home don't have access to school meals, which for many children is the healthiest meal that they get. You also have less of a routine and less of a structured eating environment. And of course, with the pandemic, so many people aren't getting out. So, obesity rising now for children, on top of just the educational challenges, is exactly what they don't need.
Well, Nancy, I heard you mention school lunches there, and we've also discussed rising rates of hunger in this country as a result of the pandemic. As some children have turned to the National School Lunch Program, I'm wondering what effect that has on providing nutritious food to children, since we know that healthy food is essential in combating obesity.
Yeah. Well, absolutely. I mean, it's unexcusable that we have 1 in 7 children who are food insecure under any circumstances. 30 million people in the United States in general are food insecure. And the pandemic, as we've seen in the news, is making that worse for everyone. I think what people really fail to appreciate is that those who have least are predisposed not only to be food insecure, but to be overweight because of it. For a lot of people, that's counterintuitive. But if you don't have access to good, healthy foods and whole grains and vegetables and fruit and a well-balanced diet, and you're subsisting on, fast food and disproportionate amounts of ultra-processed food, you're going to be more likely to carry extra weight because you're eating calorie-dense but nutrient-poor foods.
Well, like many things in this country, Nancy, we see that certain groups are more affected than others. Which groups of children suffer the highest obesity rates in this country? And perhaps more importantly, what's being done to address this disparity?
Well, unfortunately, Black and Latino children suffer more. So do Black and Latino adults suffer more. And it's really no surprise. I mean, one of the things we've seen is that in COVID-19, the gross disparity in food inequity and health inequity has really been laid bare. And we've seen that the people who live in disadvantaged communities where they don't have as much access to good food, they do have higher rates of obesity, diabetes, heart disease, and the associated diseases. And then now we see they are dying disproportionately of COVID-19. And from my standpoint, we had a good reason to address this, what we call a slow pandemic on top of a fast pandemic before. We already had the slow pandemic of obesity and diabetes. Now we have COVID-19, and it's even more important that we get on top of it.
Well, you launched the Veggies Early and Often campaign earlier this week. What is your goal, and what are some of the challenges that you're finding?
Yeah. Well, the goal is actually to raise a generation of veggie lovers. We really want to do that because it's great for kids. The barriers are that a shocking amount of our food has more sweet stuff in it than we realize. And I often say, who knew when we were thought we were feeding our kids carrots and peas, that we were really feeding them apples and pears. Many baby food manufacturers include fruits and fruit juices to make vegetables taste sweet because they think that children will like that better. Actually, what it does is develop your palate and preference for sweet and make it harder for you to like vegetables. So we're really trying to engage with baby food companies who are already putting vegetables first, get others who aren't to head in that direction. And then, as I said, raise a generation of veggie lovers. If people understand how important it is to start kids off on foods that they'll ultimately develop a taste for, what a difference it makes.
All right, Nancy Roman, thank you.
Thank you.